Okay, let's unpack this a bit. Think about medication adherence. Sounds simple, doesn't it?
It is just take the pills.
Right. Just take them as prescribed. But if you, or maybe someone you know, has managed a chronic condition, juggling different meds, times, instructions, or just sticking to it long term.
Oh, it can be incredibly tough in reality.
Exactly. It's a huge challenge for millions of patients.
And the stakes are really high. Poor adherence, it isn't just inconvenient, it directly leads to worse health outcomes, more hospital visits.
And huge costs, right,
Yeah,
across the whole system.
absolutely. So finding ways to actually support patients, to help them follow their treatment plans, it's just critical.
So that really gets to the heart of our deep dive today.
Mhm.
We're exploring how AI chatbots are being, looked at as a potential tool, a powerful one maybe,
Mm-hmm.
to tackle this exact problem, trying to genuinely improve medication compliance, specifically through things like personalized reminders and education.
And for this, we're drawing on a few things. We've got research on the AI tech itself, some concepts around AI adherence coaching.
And importantly,
Yeah, perspectives straight from healthcare leaders, talking about let's say, the real world hurdles they see in actually getting AI into clinical settings.
okay, so our mission here is to take all these sources and, distill what they're really telling us. About the promise, sure, but also the grounded reality of using these AI chatbots to help people take their meds properly.
Let's get into it.
So what's really striking, I think, is this core idea, using AI not just for basic tasks, but to really understand you, the individual patient.
Right. It's about leveraging data analytics, machine learning, applying it to grasp unique behaviors, preferences, that kind of thing.
Yeah, so the promise isn't just like a generic calendar alert going ding.
No, definitely not.
The vision is for these AI agents to give you reminders, educational bits that are genuinely tailored to your needs, your routine, maybe even acknowledging your specific worries or hesitations.
And a big part of that is natural language processing, NLP. That's the tech letting computers understand human language.
So they can actually talk to you.
Potentially, yes. Have conversations. Answer questions, address concerns, maybe even explore motivations. Things a static app just, can't do.
And that's where this concept of an AI-powered medication adherence coach starts to sound, really different. It's interactive.
Exactly. The idea is to bridge that gap. The one between maybe a quick doctor's visit and your actual daily life managing a condition.
Giving you support when you need it.
Right. Consistent, accessible support, helping you feel more supported, maybe fostering a more collaborative feel towards your own treatment plan.
Okay, but, the tech sounds promising. But bringing anything new into healthcare.
Especially AI.
Yeah, especially AI guiding patient behavior. That obviously comes with a whole bunch of questions, hurdles. And one of our sources, the one looking at healthcare leaders' views, really hammered this home.
Absolutely. It was fascinating. Their concerns often went way beyond just the tech specs. They were thinking about the people, the organizations.
Like what specifically?
Well, one big one was whether healthcare education is actually keeping up. Is it preparing future staff, doctors, nurses, everyone to really work with AI systems effectively, not just use them as a tool, but integrate them?
That's a massive point. Is the workforce actually ready? And the source also highlighted the need for real belief, real prioritization from the top.
Yeah.
From political levels, management.
Yeah, it needs that high-level buy-in to succeed. It can't just be one enthusiastic department.
It needs to be systemic.
Right. And managing change within these big healthcare organizations that came up again and again. People, departments, they're all at different stages of readiness, different levels of motivation.
So how do you tackle that?
Well, leaders felt it was crucial to clearly show the AI's value to the clinicians. You have to spark their curiosity, show them how it makes their job better or easier, not just, another thing to learn.
Make it obviously beneficial.
Precisely. And they even touched on how roles might shift. Could non-medically trained staff using AI tools start doing tasks that used to need clinical training? That's a big question.
So it really underlines that putting AI into healthcare is socio-technical.
Exactly. It's not just about the algorithm working. It's about how it fits into workflows, how it's regulated, how it actually changes the day-to-day practice. The challenges are much broader than just the tech itself.
And speaking of challenges, there was that quote from a healthcare leader, the one about AI being a little black box. That really stood out.
Oh, yeah. That captures the skepticism perfectly. If an AI gives you, say, a risk score.
Right.
and you can't explain how it got there. You can't see the logic, the factors it weighed. It's really hard for a clinician to just trust that number, especially if it goes against their own gut feeling or experience.
That lack of transparency is a huge barrier.
Definitely. And another source we looked at, a review of AI systems, pointed out a potential risk that using these systems could, maybe unintentionally, weaken those really important person-centered relationships.
The connection between the doctor or nurse and the patient.
Exactly. That human connection that's so vital in healthcare.
So that raises a massive question for the future, doesn't it? How do we use these powerful AI tools without losing that essential human touch?
It's the core dilemma.
Okay, let's backtrack slightly. How would this AI coach actually work under the hood, technologically speaking? We mentioned NLP.
Right. So the sources touch on the components. NLP breaks down text, identifies key things, drug names, dosages, maybe instructions. It can even do sentiment analysis, like figuring out the emotional tone in a patient's message.
So it understands what you're saying and maybe how you feel about it.
That's the goal. And then there's behavioral pattern recognition. That's about analyzing interaction data. When do you reply? When don't you? What questions do you ask? It tries to spot trends in your specific adherence behavior.
Like, do you always forget your weekend dose? Or get confused by certain instructions?
Yes, exactly. The AI aims to pick up on those patterns.
Is there a concrete example of how this might look?
Yeah, one source gave a good one, an LLM-powered prescription analysis tool. An LLM, a large language model, is the kind of AI behind things like ChatGPT.
Okay.
So imagine you scan a complicated prescription slip full of jargon. The AI, understanding language and medical terms, could instantly translate it into plain, easy-to-understand language just for you.
Wow. Okay. That really shows the potential, doesn't it? The benefit there is immediate clarity, less confusion,
fewer errors,
empowering you to actually understand what you're taking and why. The sources suggest tools like that could really improve adherence, maybe even cut down on hospital readmissions from medication mistakes.
And this tech can be built into personalized patient apps. Not just basic reminder apps, but ones that use AI to actively engage you. Tailored experiences, smart reminders that learn your routine.
Personalized education based on your questions.
Yeah, maybe even helping with scheduling appointments automatically.
And it's that mix, the NLP and the pattern recognition, that lets it go beyond just generic prompts. It sees you tend to miss, say, your evening dose on Tuesdays.
And it can then try a specific reminder strategy just for that gap. It gets targeted.
Okay, so let's pull this together. The tangible benefits promised for patients seem to be clearer understanding of meds.
More confidence in managing their own health.
Better adherence, obviously.
Reduced risk of errors.
And just feeling more, empowered in their health journey.
And for the healthcare system, for the providers, they could get insights into patient behavior they just don't have now.
Maybe streamline some processes, follow-ups.
Potentially. Improve patient outcomes through that personalization. And maybe find some efficiencies, too.
But the path forward, the sources make it clear, it's not just about building cool algorithms.
Not at all. There's the whole technical integration piece, getting these AI systems to talk to existing things like electronic health records, EHRs, absolutely securely. Given the sensitivity of patient data quality, encryption, these are non-negotiable.
But again and again, it comes back to the human side, doesn't it? Being technically possible doesn't mean it will work in practice.
Right. Success really hinges on user adoption. By patients, sure, but critically, by the healthcare staff, too.
They need training, support.
Ongoing support to adapt to working with AI, and the sources really stress effective change management. Plus, importantly, needing people who speak both languages, tech and healthcare.
Bridging that gap.
Yes, that collaboration between developers and clinicians is absolutely essential.
And ultimately, the sources suggest we need practical ways to actually test this stuff. In real clinics, real hospitals.
We need to demonstrate the value in regular practice, not just in theory or isolated trials.
Okay. So we explored this significant potential, haven't we? AI chatbots offering personalized conversational support for medication adherence, understanding individual needs.
And we've also really surfaced the big hurdles, often not technical, but human and organizational hurdles, identified by the people who'd actually have to implement this. Concerns around readiness, trust,
that human connection,
the sheer complexity of changing how healthcare works.
So it leaves us with this, I think, really crucial question to think about. As we try to harness AI's power, and it is powerful for efficiency, for personalization in healthcare.
How do we do it right?
Yeah. How do we make sure transparency is there, that trust is maintained, and that the vital human connection between patients and caregivers isn't just preserved, but maybe even strengthened.
That's the tightrope we have to walk, finding that balance.